Welcome, and thank you for watching the Promoting Asthma Self-Management Program module. This module will review the home-based self-management component of the Promoting Asthma Self-Management Program for children and young adults with asthma. Following this presentation, we hope you will be able to recognize the value of home-based asthma interventions, become knowledgeable about PASP eligibility criteria, understand the structure of a home visit, become familiar with how nurses and community health workers can help patients, and learn how to make a referral to the appropriate home-based self-management program. The objective of the PASP Asthma Self-Management Program is to reduce avoidable emergency department and hospital care among patients insured by Medicaid. In order to achieve this goal, the Suffolk Care Collaborative has partnered with Stony Brook Children's Hospital Keeping Families Healthy program, Northwell Health Services, and Catholic Health Services to ensure the delivery of home visits to Medicaid patients in need of asthma self-management support. Research has shown that home-based interventions with an environmental focus on children with asthma are effective in reducing the number of recorded asthma symptom days, reducing the number of school days missed, reducing the number of acute healthcare visits, including hospitalizations, emergency department visits, and unscheduled office visits, and reducing the use of beta-agonist inhalers. Such interventions have also been shown to be cost-effective. Children whose asthma is well maintained require fewer visits to the hospital, ED, and use of beta-agonists. On this slide, we will discuss how to identify patients who could benefit from a PASP home-based program, as well as delineating the specific eligibility criteria for each of the programs. The PASP program caters to patients who need help to maintain asthma control and/or at risk for an asthma-related hospitalization. The table outlines the specific eligibility requirements for each program. Let's talk about how the PASP program works. Once a patient is identified as being at risk and their eligibility has been verified, a referral can be made. Referral should be made by a primary care provider or subspecialist and can be facilitated by nurses, social workers, or care managers. The appropriate program form will need to be submitted. Program-specific referral forms as well as patient flyers can be found at the end of this presentation. Program coordinators then conduct brief intake interviews over the phone and assign a healthcare worker to make home visits to the patient based on cultural and geographical characteristics. Nurses and community health workers may make arrangements to meet with the patient and family in their home at their convenience. Home visits may be conducted by primary care nurses or community health workers or CHWs, who act as an extension to the primary care or subspecialist's office. CHWs are non-licensed healthcare workers. Nurses and CHWs complete a comprehensive classroom-based training and orientation, followed by field training and ongoing quality assurance monitoring. Training for those who make the home visits is supplemented with materials from the Association of Asthma Educators. The goal of each visiting healthcare worker is to help their patients manage their healthcare independently. On this slide, we discuss how healthcare workers can help your patients through this home-based program. The healthcare worker can assist the patient and family during visits by ensuring the patient and family have an updated copy of the Asthma Action Plan, helping to obtain medications and equipment, like spacers, for school, childcare locations, extracurricular programs, and others, conducting asthma trigger environmental evaluations in the home, providing educational materials pertinent to promoting asthma self-management, personalizing medication logs, connecting the patient to a provider in order to address asthma-related questions and concerns, helping to make follow-up appointments and coordinate appointments with multiple healthcare providers, setting up a schedule to follow up home visits and check in via phone or text messages to help address any unmet needs, and connecting the patient with resources available in the community for trigger reduction. During the initial visit, the nurse or CHW will do a brief intake with the family and ask about the patient's history, social and behavioral determinants of health, as well as barriers to receiving care. Nurses and CHWs will help clarify how and when to use medications in accordance with the patient's asthma action plan. Nurses and CHWs review the signs and symptoms of an asthma attack as they correspond with the patient's asthma action plan. How and when to get medical help is reviewed with the patient and family. Nurses and CHWs also provide and explain asthma-related educational materials. At the end of the visit, the nurse or CHW will facilitate the scheduling of follow-up asthma-related visits and verify logistics. For example, a patient's transportation and insurance status. Various tools may be used by nurses and CHWs to educate patients on their asthma and promote self-management. Asthma education materials often include a patient's asthma action plan, which is a plan with instructions for early treatment of asthma symptoms. General asthma education, for example, handouts which outline what asthma is, how to use medications, different types of medical equipment, the difference between controller and rescue medications, and typical asthma triggers. Additionally, the healthcare worker will provide and review personalized medication logs with the patient and distribute note sheets for the patient to bring along to their next primary care or subspecialist follow-up. One of the main components of the PASP home-based asthma program is the environmental trigger assessment. Environmental trigger assessments can be conducted by both nurses and community health workers. Once the nurse or CHW feels that they have an established rapport with the patient and their family, they will conduct an environmental trigger assessment. The assessment will be conducted using an environmental trigger checklist provided by the National Environmental Education Foundation. The nurse or CHW then spends time with the family and goes through their home, helping to identify triggers that are present. Once triggers are identified, the healthcare worker will discuss how to mitigate triggers and distribute appropriate asthma trigger education materials. A nurse or community health worker can also assist in referring a patient to asthma-related community organizations as needed. There is no set number of visits associated with the PASP home-based self-management program. Healthcare workers are able to establish a rapport with families and tailor the programming and visits to the family's needs as they see fit. After each visit, a summary is sent to the referring provider. How to make a referral. If your patient meets all of the previously mentioned eligibility criteria, please confirm the family's willingness to participate and complete the appropriate referral form. Referral forms and program-specific flyers can be found on the SCC website in the For Partners tab. The page which hosts each program's referral forms and brochures is pictured here on this slide. Thank you for taking the time to learn about the Suffolk Care Collaborative's Promoting Asthma Self-Management program.